India struggling against COVID-19. Why the world should worry. India is in a horrible situation as it faces the latest wave of COVID-19. Unlike previous waves, this one surged the rates of new cases and new deaths with a scary tone. Ironically, the surge isn't supposed to happen since India is the biggest vaccine producer and has almost defeated the pandemic nationally. According to The Atlantic, the current onslaught of the coronavirus can lead to cascading effects outside the second most populous nation. At least 92 developing countries depend on India for supplying them with vaccine doses. If India is completely taken over by COVID-19, the production of Serum Institute is prone to total paralysis, putting millions of lives at risk. But how did India get to this point? Michael Kugelman, Deputy Director of the Asia Program at Wilson Center, revealed three key factors that created the perfect storm. First, coronavirus variants have fully established themselves in India. Second, multiple mass gatherings recently occurred that made most attendees prone to infection. And third, the general complacency of the Indian government spawned a slow response to the crisis. Combining all three factors, people went to these gatherings without face masks or physical distancing made them highly susceptible to variants with high transmissibility rates. Due to complacency, thinking the pandemic is won, people who got infected by SARS-CoV-2 variants rapidly choked hospitals. Since patients can take weeks to fully recover, hospitals lack the beds and equipment to accommodate tens of thousands of patients coming in daily. Times of India recently reported that the country detected a new triple mutant strain, and it's just the latest after the double mutant variant B.1.617 emerged. The latter is believed to have fueled the unusual rise in new cases. Even though experts have no evidence to suggest the variant is more deadly, the potential of being more infectious is yet to be disproved. Now, oxygen tanks got depleted, morgues left no more space, and crematoria at the brink of melting with almost constant use. Serum Institute, meanwhile, delayed vaccine supply to the international community, including the COVAX initiative. As the situation worsens, SII had no choice but to help address India's own battle. And without many doses left, SII had to import vaccine doses from other countries to vaccinate Indians. Some nations and individuals didn't leave India in the war as they donated oxygen and other medical equipment.